Let's take a look at both Toronto and Montreal as Canada's two biggest provinces both report the highest number of new COVID cases in one day since the pandemic began. For more on the new record numbers of COVID cases set in Ontario and Quebec, I'm joined by Dr. Jennifer Kwan, a family physician from Burlington, Ontario, and she joins us now from that city. Thank you for your time. I appreciate it. So the new number, 3,328 new COVID-19 cases, 56 new deaths in Ontario. And as you know, this is the third consecutive day the province has broken its record for highest number of cases. How concerned are you by this trend?
Well, it's definitely quite concerning to see the numbers go up day by day. And we still haven't seen the outcome of any potential Christmas and other holiday gatherings because it's only been a few days out. So we do expect it to continue to rise, and that will also include hospitalization numbers and deaths as well.
You bring up an important point that it's believed these are not the numbers that we expected to see, the rise that doctors were warning about if people gathered over Christmas. So what you're saying, just to clarify, is that this increase, these record numbers day after day, does not yet reflect the Christmas holiday. And if that is the case, then what are we in for?
Well, I can't exactly say how high it will get, right? Because there were also additional restrictions imposed on Boxing Day. So the next few weeks will be very telling. But regardless of what the numbers are, it's just so important for us to manage our own risk and to follow public health guidelines and stay home if possible. And, wash your hands, wear a mask, still distance, and do all those things that we've been using so far these past few months.
Are you worried about New Year's Eve tonight?
Well, hopefully, when everyone sees all these numbers, I do hope that nobody is having a holiday party or countdown party. Now is not the time. Maybe in the next few months you can count down to like March break or something, but not right now.
This past weekend in Ontario, there was criticism that not all vaccine clinics were open for people on the front lines to get their shots. Critics are concerned about the pace of the rollout in this province. In your estimation, is enough being done to get people their vaccines in Ontario?
So it is unfortunate that vaccinations were stopped over the holidays because many people are very eager to get them, especially those in the frontline workers, those in long-term care homes, and each delay does cause more deaths. So I do hope that with New Year's Day, I believe General Hillier has said that he will be running clinics 7 days a week and ramping up quickly so that everyone who wants a vaccine can get one as soon as possible.
As for measures, there will be some who will say in the Toronto area, for example, by the time the provincial lockdown ends, at the date we know now, at the end of January, that region will have been under lockdown for about 60 days. So some people questioning whether that is the right tactic. In your opinion, what else should we be doing to slow these numbers down?
Well, lockdown is not a permanent solution. As you know, there are many consequences to lockdowns, and it's not really a good thing that, especially if it has to be recurrent, that's awful. So we need to use this time wisely to build up testing, tracing, isolating systems, to implement more safety measures in workplaces, in schools, to address ventilation issues, and to encourage all public health measures to be, properly analyzed to see where we are missing any gaps.
Final thought, all those things you just listed there, I heard doctors saying at the beginning of the pandemic, 9-10 months ago. Why do you think we are still, or you as a physician, are still asking for these measures?
Well, I think it is very frustrating when, a lot of things seem quite obvious to implement. I do understand, the politicians and people in charge have to consider not just the medical aspect, but also, funding and economy and things like that. The thing is, being proactive, although it may seem like a large upfront cost, actually will save us costs in the long term because that will reduce any restrictions, reduce the durations of lockdown if we are proactive instead of being reactive.
Doctor, we really appreciate your time and insights on this today. Thank you. Dr. Jennifer Kwan is a family physician in Burlington, Ontario.